Anemia is a common blood condition that affects millions of people worldwide. It occurs when your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. This can lead to a variety of symptoms and health issues. Red blood cells are crucial because they transport oxygen from your lungs to the rest of your body. When you don't have enough of these cells, your body struggles to get the oxygen it needs to function properly. This lack of oxygen can make you feel tired and weak, and it can affect your ability to perform everyday activities. Without enough healthy red blood cells, your body can't work as efficiently as it should. This can lead to a range of symptoms including fatigue, weakness, and shortness of breath. You might find it difficult to get out of bed in the morning or to keep up with your daily routine. Even simple tasks can become exhausting. Anemia is a widespread condition that affects people of all ages, genders, and backgrounds. It can be caused by a variety of factors including nutritional deficiencies, chronic diseases, and genetic conditions. The severity of anemia can vary greatly. Some people may have mild anemia with few symptoms, while others may have severe anemia that significantly impacts their quality of life. In some cases, anemia is temporary and can be treated with dietary changes or supplements. In other cases, it may be a chronic condition that requires ongoing management. For some individuals, anemia is a lifelong condition that requires regular monitoring and treatment. It's important to work with your healthcare provider to develop a plan that's right for you. The good news is that anemia can often be managed effectively with the right treatment. This might include dietary changes, supplements, medications, or other therapies. There are many different types of anemia, each with its own cause and treatment options. Some common types include iron deficiency anemia, vitamin B12 deficiency anemia, and anemia of chronic disease. Understanding the specific type of anemia you have is crucial for determining the most effective treatment plan. Your healthcare provider can help you identify the cause of your anemia and recommend the best course of action. For example, iron deficiency anemia is often treated with iron supplements and dietary changes, while vitamin B12 deficiency anemia may require B12 injections or supplements. Anemia of chronic disease, on the other hand, may require treatment of the underlying condition in addition to managing the anemia itself. Educating yourself about anemia and working closely with your healthcare provider are key steps in managing this condition effectively. If you think you might have anemia, it's important to talk to your doctor. They can perform tests to determine if you have anemia and identify the underlying cause. With the right diagnosis and treatment plan, you can manage anemia and improve your quality of life. Don't hesitate to seek medical advice if you have symptoms of anemia. Red blood cells are the workhorses of your bloodstream. These tiny, disc-shaped cells are crucial for your survival and well-being. Their main job is to transport oxygen, a task they perform with remarkable efficiency. They pick up oxygen in your lungs, where the air you breathe in is rich with this vital gas. Then, they deliver it to every cell in your body, ensuring that each one has the oxygen it needs to function properly. This oxygen is essential for energy production and overall health. Without it, your cells wouldn't be able to produce the energy required for daily activities, from simple movements to intense exercise. Imagine your red blood cells as tiny delivery trucks, each one loaded with precious cargo. Each truck is loaded with oxygen, ready to be transported to where it's needed most. They travel through your blood vessels, which are like highways throughout your body. These highways ensure that oxygen reaches even the most remote cells. When they reach their destination, they unload the oxygen to the cells that need it. This process is continuous and vital for maintaining life. In anemia, there aren't enough of these delivery trucks. This condition can be caused by various factors including nutritional deficiencies, chronic diseases, or genetic disorders. This means your cells don't receive enough oxygen, leading to a range of symptoms that can affect your quality of life. As a result, you might experience fatigue, weakness, and other symptoms. These can be particularly debilitating, making everyday tasks feel exhausting. Understanding the vital role of red blood cells helps us appreciate why conditions like anemia can have such a significant impact on your health. By ensuring our red blood cells are healthy, we support our overall well-being. Iron deficiency anemia is the most common type of anemia, affecting millions of people worldwide. It occurs when your body doesn't have enough iron to produce adequate levels of hemoglobin, the protein in red blood cells that carries oxygen throughout your body. Without sufficient iron, your body can't produce enough hemoglobin, leading to a decrease in the number of red blood cells. This can result in symptoms like fatigue, weakness, and shortness of breath. Iron is crucial for making hemoglobin, which binds to oxygen in the lungs and carries it to tissues throughout the body. Hemoglobin is what gives red blood cells their color and their ability to transport oxygen. Hemoglobin is found in red blood cells, and it's responsible for carrying oxygen from the lungs to the rest of the body. Without enough hemoglobin, your tissues and organs don't get the oxygen they need to function properly. Think of iron as the key ingredient in a recipe for healthy red blood cells. Just like a recipe needs the right ingredients to turn out well, your body needs enough iron to produce healthy red blood cells. Without enough iron, your body can't produce enough hemoglobin, leading to a condition known as iron deficiency anemia. This can cause a range of symptoms, from mild to severe, depending on the level of deficiency. This leads to a shortage of oxygen-carrying red blood cells, resulting in iron deficiency anemia. Symptoms can include dizziness, headaches, and pale skin, among others. Several factors can cause iron deficiency anemia. These include blood loss, poor iron absorption, and a diet low in iron. Blood loss can occur due to heavy menstrual periods, surgery, or gastrointestinal bleeding. Poor iron absorption can be due to conditions like celiac disease or Crohn's disease, which affect the intestine's ability to absorb nutrients. A diet low in iron is another common cause, especially in individuals who don't consume enough iron-rich foods. Iron is found in foods like red meat, leafy green vegetables, and beans. Including these foods in your diet can help prevent iron deficiency anemia. Treating iron deficiency anemia typically involves increasing your iron intake. This can be done through dietary changes such as eating more iron-rich foods or by taking iron supplements as prescribed by your doctor. Iron supplements can help replenish your body's iron stores and improve your hemoglobin levels. It's important to follow your doctor's recommendations and have your iron levels monitored regularly to ensure effective treatment. Section 4, Vitamin B12, Deficiency Anemia. Vitamin B12 is another essential nutrient for healthy red blood cells. It helps your body produce DNA, which is the genetic material in all cells. Without enough vitamin B12, your red blood cells can't divide and multiply properly. Imagine vitamin B12 as the fuel that powers the production of red blood cells. When your body is low on this fuel, red blood cell production slows down, leading to anemia. Vitamin B12 is found in animal products like meat, poultry, fish, and dairy products. People who follow a vegan or vegetarian diet are at a higher risk of vitamin B12 deficiency. Treatment for vitamin B12 deficiency anemia typically involves vitamin B12 supplements. These supplements can be taken orally or given as injections. Section 5. Anemia of chronic disease. Anemia of chronic disease is linked to other health conditions. These include chronic infections, inflammatory disorders, and kidney disease. These conditions can interfere with your body's ability to produce red blood cells effectively. Think of chronic diseases as roadblocks that disrupt the normal production of red blood cells in your body. These roadblocks can prevent your body from using iron effectively or producing enough red blood cells in the bone marrow. Treating anemia of chronic disease often involves managing the underlying health condition causing it. In some cases, your doctor may recommend iron supplements or other medications to stimulate red blood cell production. Section 6. Recognizing the symptoms of anemia. Anemia can manifest in various ways. Common symptoms include fatigue, weakness, shortness of breath, pale skin, dizziness, headaches, and cold hands and feet. Fatigue is often the most noticeable symptom. You might feel tired all the time, even after getting enough sleep. Shortness of breath can occur because your body is not getting enough oxygen. Pale skin is a sign of reduced blood flow and oxygen to the skin. If you experience any of these symptoms, it's important to consult with your doctor. They can perform a blood test to check your red blood cell count and determine if you have anemia. Section 7. The importance of seeking medical advice. Anemia is a treatable condition, but it's important to seek medical advice for proper diagnosis and treatment. Self-treating anemia can be dangerous, as the underlying cause needs to be addressed. Your doctor can determine the type of anemia you have and recommend the most appropriate treatment plan. Treatment may involve dietary changes, supplements, or medications, depending on the cause and severity of your anemia. Early detection and treatment are crucial. Untreated anemia can lead to complications such as fatigue, heart problems, and pregnancy complications. By seeking medical attention, you can manage your anemia effectively and improve your overall health and well-being.